a late presentation is very common to a particular gynecological problem. I believe if you watch this video, listen to the messages of this video, you will be able to save many lives in your own lifetime because you will know exactly how not to drive the car in a completely wrong direction. Often, I see patients who get treated by inhalers thinking that they have got asthma before getting diagnosed to this gynecological problem. It is also common that the patient herself thinks that she is just gaining a little bit of extra weight before we find out that her whole abdomen is full with water. Or sometimes we see that she is getting treated for gas and acidity over many weeks or months before she gets diagnosed with this problem. Soon she will stop moving her bowel and will stop eating. Now, if you think that I am here to blame the patient and their family for late presentation, you are wrong. And if you thought that I am here to blame the doctors who saw the patient preceding few weeks to few months before the patient gets diagnosed of this problem, you are equally wrong. I am not here to blame anyone at all because this is a disease where diagnosis can be very challenging. With respect to everyone, awareness about this disease in overall society is shockingly low. Now, why is that? Because this is a gynecological problem, but the symptoms, the problems with which the patient comes are mostly non-gynecological. This is a classic example of a symptom confusion, which leads to wrong diagnosis quite often. Because of my profession, I happen to see such patients almost daily. Behind majority of those patients, there are heart-wrenching stories of not getting diagnosed early enough. It brings tears to my eyes because if a patient comes from Kuch Bihar, if a patient comes from Batuan, if she is from Shambazar or from Guriahat, or when I was in England, if she comes from Manchester or from London or from East Kent or Canterbury, everywhere almost we see the same type of story. It's almost like a film where someone has written a screenplay with a very minor deviation. Now, why a patient or groups of patients will tell the same story again and again regardless of wherever they come from? Because the major problem, the main problem of the diagnosis is same all over the world because of, as I said, the classic deception by the symptoms. Ovaries are two almond-shaped organs in women's lower part of abdomen. Till menopause, it produces one egg each month and also produces female hormones estrogen and progesterone. After menopause, ovaries stop functioning. Uncontrolled abnormal cell divisions originating from ovaries are called ovarian cancer. Interestingly, cancer from fallopian tube and peritoneum are also classed under ovarian cancer. This is because ovarian cancer, fallopian tube cancer, and peritoneal cancers are kind of same. I'm not going into elaborate details of what are fallopian tube cancer and peritoneal cancers. In some future video, I'm sure we'll get to know about those things. Now, here is something surprising. Ovary can also be a place for expression of tumor from an unrelated organ. Cancer of stomach may manifest as ovarian tumor. Breast cancers may present as ovarian tumor in the first place, etc. These are false ovarian cancers and not proper ovarian cancers. Therefore, these are not treated in the line with ovarian cancer treatment. Now, if you have got confusion, what are the ovaries? You may very well watch our Anatomy with Coffee series where we have explained what are the various different gynecological organs, ovaries, fallopian tubes and uterus and all those kind of things. I will link somewhere in the description so that you can have a watch. Ovaries are gynecological organs, but if you expect gynecological symptoms as a part of manifestation of ovarian cancer, you will be cheated. And that's the main secret story of ovarian cancer. Why it is so difficult to pick up. Most of the ovarian cancer symptoms are bowel related. And the symptoms can be so subtle that it may come with abdominal pain or some feeling of full very easily and all those kind of bowel problems. So it can be very easy to actually miss out those symptoms. And therefore women may sometimes present to doctors very late. But no more, because you are going to learn about all these things today, won't you? It can be so deceiving that many women miss these symptoms and only will come to a doctor when disease has progressed. Some of the symptoms of ovarian cancers are feeling constantly bloated, abdominal swelling, pain or discomfort in abdomen or in lower abdomen, feeling full early. After having meal, the patient may think that she is getting very full very early. Frequent passage of urine, and these could be the few symptoms of ovarian cancers. Did you notice that abnormal bleeding or gynecological symptoms are not part of usual ovarian cancer symptoms? That's a trap. Ovarian cancer can mimic irritable bowel syndrome symptoms in spite of being a gynecological organ. Of course, if you have got those symptoms, not all will be from ovarian cancer, of course, but we need to be aware of. For an example, if someone has got a chest pain, not everything will be because of heart attack or some cardiac problem. It could be from various other things. Still, if someone has got a chest pain, most of the times we get at least an ECG done to check that it is not because of the cardiac problem. You have learned today a lot about ovarian cancers. The information so far which has been hidden in medical books sometimes. I am sure that this will help you and people around you to save lives. That's all today. Have a good time.